Hey, it's Dr. Troy here, the Vancouver chiropractor. A lot of people say, what do I do? I've been in a recent car accident. What should I do? Should I go to the hospital? Should I see my general practice doctor? Should I go to a chiropractor, physical therapist, acupuncturist? And I want to tell you that many cases that are involved in a motor vehicle collision, a lot of times the patient will go to the hospital. They'll evaluate them for things that are life-threatening, fractures, things that need surgical intervention. And many of these soft tissue cases, the patients are dismissed from the hospital and say, follow up if you need with your general doctor, and they prescribe them some sort of medication, whether it's muscle relaxers, anti-inflammatories, painkillers. And that's typically how we see a lot of car accidents come to our office. They went to the hospital and they got worked up, and the hospital said, well, you're probably just going to be sore, nothing's wrong. So I always encourage patients who've been in a car accident to get into the office as soon as possible. Just like if you broke a bone, you would go set that bone with an orthopedist as soon as possible and have a cast put on. So if you've been injured in a car accident, rear-ended, sideswiped, head-on collision, any of these collisions that create impact and damage and then also result in you suffering, these things need to be addressed right away, because if you tear soft tissue, even microscopically, it bleeds, and usually second, third day is going to be the worst. So I'll ask patients many times, when did you notice the worst? And it's usually the second and third day. And if that fits your profile, you need to make an appointment as soon as possible to get evaluated. So what do? Patient comes in, they've been in an accident, they're hurting, it's third or fourth day or 3 weeks later. The harder cases are the ones that wait to come in. They've waited 4 weeks, they waited 8 weeks, they waited 12 weeks, and they've tried a bunch of other things, and scar tissue now starts to heal improperly. It lays down on lines of stress where joints aren't used properly, so it creates a lot more fibrosis in the joints, a lot more scarring, a lot more gristle, and therefore can lead long-term to chronic problems. The estimates are anywhere from 60 to 80% of people in car accidents have residual symptoms 10 years later, and we don't want that to happen. And one of the main reasons that happens is they didn't get proper care. So what's proper care? Well, if the joints in your spine aren't moving because they've been injured, they're going to heal incorrectly. The whole purpose of chiropractic and the therapies that we use, including massage and rehab, the whole purpose is to get the body, get the joints moving properly while you're healing. And that's why it's so important to get in sooner than later, is to start putting motion into joints that aren't moving so that they heal with proper range of motion, proper function. And if joints don't move over time, that's one cause for spinal disc degeneration or degenerative disc disease or arthritis. So the sooner the better. And then you may need a series of adjustments or massages or a rehab to fully correct and stabilize the soft tissue. The research shows ligaments take anywhere from 12 weeks up to 18 months to fully heal. And so if people don't get proper care, they're going to heal wrong, and that leads to chronic issues. So if you've been in a recent car accident, call our office. We'd be happy to check you out, see what's going on, see if chiropractic's right for you. We work with most insurance companies. You don't have to have a referral from a medical doctor to come see us. We verify benefits. We take third-party liens. We work with attorneys. Our whole goal is to get you back on track, get your life back from a collision that you weren't expecting to have happen to you in as soon as possible time frame. So if you're interested in a consultation, 360-260-6903.